Good morning, good afternoon, good evening from wherever you're joining us from. Thank you very much for joining us for today's exciting webinar. Today's webinar is hosted by JSI, and they are going to talk about harnessing the power of enterprise architecture for health information systems. Welcome to the webinar, and as you join the webinar, my name is Rose Nzioka. I'm one of the co-chairs for GDHN. We are really excited to host this webinar, and also just want to give you a reminder that GDHF 2024 is coming up. I'm sure you saw the save the date go out. You saw that we are going to be hosting this forum in Nairobi this year. And we are really excited and looking forward. The call for abstracts is out, so look out for that and make sure you mark the calendars for the timeline for submission, because it does fly by very quickly. So for today's webinar, I'm going to hand over to Christina, who is going to introduce the JSI team. Thank you, Christina. We're excited to hear what you guys have to share. You're on mute, Christina.
Goodness. Okay. 1 second. I'm having a screen sharing. Hi, everybody. Sorry, 1 second. All right. Okay. Hi, everybody. My name is Christina Villela, and I am a senior technical advisor with JSI Center for Digital Health. And I'm very excited about our webinar today. And thank you for the GDHN team for having us. Before I introduce our wonderful panelists, I just want to start by setting the scene for today and why we organized this webinar. So this webinar is looking at, again, as Rose said, how can we harness the power of enterprise architecture for health information systems? And this graphic here on your left, this is the digital health architecture vision for Uganda, and it may look familiar to many of you, maybe not the Ugandan version, but maybe you've seen a similar version for a country you're working in or that you are working with yourself. And this webinar is really our idea is that we want to see how these blueprints can be taken from software architecture into actually improving health. So as we know, enterprise architecture provides us a framework for aligning the business processes of a health system with their information needs, their technology needs, and with the ultimate goal of actually improving health outcomes. So we're not implementing systems for the sake of systems. We're not even implementing them to show that we can create this beautiful diagram and actually do the interoperability, but we are doing it so that we can improve health outcomes, so that the clinician here on the right has the resources and the information needed to provide that child with the vaccine that they need at the right time. And so we really wanted to kind of expand the dialogue today on not just how do we create these blueprints, but how do we actually implement them? So with that, our agenda for today is that we are going to hear from several speakers from Ethiopia, Indonesia, and then the Asia region through the Asia eHealth Information Network. So they'll give some presentations on how they have been working to implement enterprise architecture within their health systems. And then we'll have a moderated panel discussion to kind of really flesh out some of the nitty-gritty of how do we actually do this implementation? What are some of the key driving factors for success? What are some of the challenges? What do you do if you're just starting and you want to you're not sure where to start on designing your enterprise architecture? And then, of course, we will also leave time for your questions at the end. So with that, I would like to introduce our wonderful panelists. So first we have Emmanuel Baru, who is the Deputy Project Director and Digital Health Lead for Ethiopia's Data Use Partnership. Emmanuel has been working with the Ethiopian Ministry of Health with the Data Use Consortium, offering valuable thought leadership and technical expertise in digital health. With over 17 years of experience in the Ethiopia health industry, Emmanuel has been instrumental in developing and standardizing various digital health systems and Ethiopia's digital health domestic and international platforms. And next we have Tawfiq Sidimpo. Tawfiq has a senior technical advisor with Chisu Indonesia since 2021. I was about to say 2001, 2021. And Tawfiq collaborates closely with the Ministry of Health Digital Transformation, Digital and Information System to implement National Health Information Systems Program. Tawfiq brings over 15 years of experience in Indonesian health information systems, particularly in interoperability and data utilization, to support the use of public digital tools. And last but not least, we have Jai Ganesh Uday Shankara. Jay is the the executive director of the Asia eHealth Information Network, also known as AHIN. He has over 19 years experience in planning, procurement, implementation of wide spectrum enterprise digital health solutions, including web-based hospital information systems, picture archiving, communication systems, telemedicine, teleeducation, chronic disease management needs, etc. He has been a resource person for national health information capacity strengthening and digital health convergence workshops facilitated by AHIN, together with ministries of health partners in the Southeast Asia and Western Pacific regional countries. So thank you very much to our panelists for joining us today. So why are we talking about enterprise architecture and why is it important for health information systems? As I mentioned earlier, enterprise architecture provides an approach for developing a cohesive blueprint that links a country's health information system with its business processes, information needs, and technology. And by business processes in the health context, we mean the health services that are delivered by the health system and the workflows and the data flows that are needed by the health system to provide timely quality care. In a study that AHIN conducted in 2020, some of the main reasons that countries were either considering adopting or had adopted enterprise architecture were interoperability, the need to connect different systems to make information available at multiple levels of the health system, at multiple places of the health system to provide not only a high level view of the health system, but also to provide that continuity of care and quality of care. Another reason was a lack of technical infrastructure and a struggle to kind of align that with the business needs, or again, the health system, the health services delivery of the health system. So those were kind of some of the benefits and the main reasons that countries were looking to adopt enterprise architecture. Some of the common frameworks in use here on your screen, most notably the ones that you may recognize are the Open Group Framework, which is the TOGAF framework, and OpenHIE, but also Zachman and the Federal Enterprise Architecture Framework are others that are being used by countries to structure their health information systems. So we talked about the benefits, and there's many benefits that we have been, determined by those who are looking to adopt enterprise architecture. But the study also found that there are challenges in adopting enterprise architecture. And some of the key challenges were a lack of knowledge of senior leadership within health systems about enterprise architecture. And so therefore, this also hindered their overall leadership and involvement with the enterprise architecture initiatives. There was also a lack of communication to employees and stakeholders about enterprise architecture implementation. And so this can be a real challenge, especially when we're talking about implementing enterprise architecture, given that it is meant to be an organization-wide change approach. So as I mentioned, it is connecting the business processes, the information needs with the technology needs. So enterprise architecture should not just be sitting with the technology department, with the digital department, but it really should be an organizational wide change. And so these challenges were, key barriers to implementation. And you can see here that the authors of the article and of the study did recommend the need for building internal capacity for enterprise architecture in health organizations. And so this really spurred our this webinar and this work that we've been doing to kind of to really engage in a dialogue on the implementation of enterprise architecture. So with that, I'm going to hand it over to our first speaker, Emmanuel Baru from Ethiopia, to talk about Ethiopia's pathway to developing and implementing their enterprise architecture. So over to you, Emmanuel. Emmanuel, are you there?
Yes, I'm sharing my screen. I'm sorry.
That's okay.
Is my screen visible?
Yes.
Thank you so much. So, thank you, Christina, for the nice introduction. And thank you, everyone. Good morning, good afternoon, and good evening for those all. So, I'll try to go through Ethiopia's enterprise architecture journey, including the maturity assessment aspects. So, just to outline, I'll go through the evolution aspect of the Ethiopia's HIS and digital health, key milestones, and what drives those key milestones, as well as the enterprise architecture journey, including maturity. So to see the journey at glance, I want to just mention two important dates. I mean, two important periods that paved the way for Ethiopia's HIS and digital health. First one is 2007 to 2011, in which HIS reform happened with the principles of standardization, integration, and simplification. These are big concepts, and I can unpack them if need be. The other type is 2017 through 2021, in which the health sector transformation plan, the first plan, was launched with information revolution agenda on top of it. Just to take you through the key digital health milestones in Ethiopia, there have been key driving forces among many. Just I want to highlight a few. Back in 2017, the Ethiopian health information system and digital health was characterized by fragmentation, lack of data and interoperability standards, vendor-driven approach, and of course proprietary systems that short-lived, and of course they were donor-driven, project-based, and pilot limited. That drive for us to come up with some significant move. The first initiative that framed our digital health is EL's architecture back in 2017. This is just a system. As you can see, it is a roadmap. EL's architecture is a road that frames which key digital health systems are available in the space, which respective domains they are aligned to, and how they communicate to each other so that business intelligence and improved health outcome can be ensured. In this regard, we have shared services in the form of package, point of service systems at implementation sites. We have institution-based services, population-based services, analytics and business intelligence services, as well as in the middle, the interoperability services, and some enablers like the national ICT infrastructure, as well as the governance principles and processing standards among the components of the EL's architecture. Okay, that was not good enough. Back in 2021, we didn't fully understand where we were, even though we have been implementing massive number of systems, where we need to improve and how we are going to do it. For this, we came up with another initiative, that is the HIS maturity assessment in January 2021. We conducted overarching maturity assessment for the health system, coming up with the current status maturity of the health information system. We set the future state and we analyzed the gap between the two. Then we came up with mission critical activities and improvement roadmap for that. That has been a massive initiative. Yet, while we made aggressive investments in digital health, we somehow lacked focus and direction for our scarce resource. It is a huge investment by itself, especially three things. One, lack of objective mechanisms to prioritize and balance digital investments. Some are right skewed, some are left skewed. We have to deal with that. Insufficient evidence of the impact in terms of data quality and utilization was also one of the issues that we dealt with, and lack of alignment of those several fragmented digital investments with global strategies and local initiatives that have been launched by the government. To deal with that, we came up with the digital health blueprint back in August 2022. It was politically led by the Minister Office, and GSI supported the entire process. Among other things, it has got 10 strategic initiatives for 10 years through 2030. It is developed based on the rigorous standard, ITU's standards, as well as domestic and different African and Asian countries' standards that are of similar background. And proud enough, we guided through this document the restructuring of the Ministry of Health's Digital Health Executive Office structure, which is a huge structure for digital health investment in Ethiopia. Yet, even though we established data interoperability standards, we couldn't prevent unauthorized systems that forced us to maintain outdated ones, continue to bear the burden of the systems. To deal with that, we came up with digital health project inventory system, which is a digital health clearinghouse and certification mechanism, which registers, validates, certifies, or declines if it doesn't fulfill the criteria or standards, and implement. For that to happen, we also have like the Digital Health Innovation and Learning Center, where, among other things, it also serves as a center for digital clearinghouse and certification platform. Despite extensive digitization efforts in the health sector, there remained a disconnect between the health system and the technologies. That was the problem still we dealt with. So for that, we had to come up with the enterprise look of the Ethiopian digital system. So we needed to come up with the enterprise architecture since 2023, last year, to align the business to the data, the application, and the technology. For that, currently, we have already developed the enterprise. We came up with the enterprise architecture capability maturity assessment results, which we have already documented. We are currently in the middle of developing the enterprise architecture, almost more than halfway. We are planning to deal with the enterprise architecture governance and change management mechanisms through different tools, especially the COVID-5 and the Prince2, and then we go for implementation. So the journey was not easy. These were some of the steps that we followed. We made the business case. We had to convince the Ministry of Health, outlining the rationale for this architecture development and securing its approval. We then established the core team at national level that is currently evolving into architecture board. We identified stakeholders for collaboration. We gained hands-on experience through different mechanisms, and we defined key deliverables. Finally, we underwent the TOGAF framework training because we had to come up with a pool of experts that lead the entire process, because we are dealing with the entire country of 120 million population. Then we developed and reviewed the capability maturity assessment model for Ethiopia's context based on TOGAF insight. And finally, we conducted the assessment. We came up with the current status, the future state, the gap analysis, and identified mission critical levers to implement on the days to come. This is a summary. The average maturity is 2.0, that is 2024. The to-be status is 3.5. score. That is the managed status that we aspire to meet after 3 years. So sometimes people ask a question like how we dealt with this future state maturity definition. It is basically using four approaches. One is gap analysis, definitely. The other is benchmarking based on industry standards globally. The third one is aligning with Ethiopia's strategic plans, even beyond the health sector. And finally, coming up with expert opinion based on trend analysis and other factors. Thank you so much. Over.
Thank you so much, Emmanuel. And I know you said you were going to be pressed for time, but you actually were quicker than you even estimated. So now we're going to hear from Taufik, who's going to share some of Indonesia's journey and designing and implementing their enterprise architecture. So Taufik, I'm going to share the slides and then we'll be over to you.
Yeah, thank you, Christina. And thank you to Emmanuel for the first presentations. So we continue about the Indonesia context here, especially how to develop and how to implement enterprise architecture for the Indonesian context. I'm working with the CISO, especially how to strengthen the governance, availability, and interoperability, and increase the demand and use of the health data and information system. It's very, very clear to mention about we have to support evidence-based health decision and policy in seeking optimal health service. Christina, next. Yeah. And in CISU currently, we are working at the national levels and also sub-national level. So it means we have to see and fill the gaps between how to implement or develop the new of the enterprise architecture or blueprint in this our health program. Especially we are working now how to use the Satu Sehat is like the national current context to see the activities about digital and health information system implemented in our area nationally and subnational levels. And we have to mention about our tools here. I think we have the same with the Ethiopia context. We utilize our SOCI, States of Continuous Health Improvement, especially how to see and fill the gaps between national implementation, subnational, and to see how to implement based on our project. We hope this is very important on how to implement governance system and quality of data as well in this area. So we have the same condition in Utopia for the SOCI implementations. Next. And based on the discussion here, since COVID-19 has happened before, especially we have to make a great objective, especially to streamline the more than 400 existing information system and created digital health transformation strategy and architecture. And we are published of the blueprint of health transformation strategy, including the digital area. So it's very important to see how to see the opportunity subnational level implementation from development partners and also the top-down approach from the national level, and it's like the emerging or convergence between subnational and national level interventions. And the first area is the integration of development health data system and integration development application system, and also to build the good ecosystem in this area as well. Next, Christina. So to executing digital transformation based on the blueprint here, we saw effectivity about activity about impression we want to hear over people in 2024, especially about medicine prescriptions, service at facility level, and also home facility for the healthcare. And we can see this very opportunity how the digital transformation, how the enterprise architecture must be applied, must be respond the health problem, must be respond the outcome of the health system as well. This must be good point to raise for the discussion. Next. And in Indonesia, we established the conceptual national health information system. We call it like Satu Sehat. It's like connecting health data ecosystem. And it is very important to see the number of the facility currently, currently it's like the public and private facility must be connected to ecosystem healthcare industry, and you see the activities must be connected with the technology and data platform itself, such as the platform of the interoperability or extended data. So this is very important of the utilize the component or domain of the enterprise architecture and able to see the area we have to concern to establish the interoperability, for example, the governance or regulations, standardization for the technology of healthcare, the patients or care service, and also the patients, sorry, the health data master, such as patient registry, health worker registry, financing, health services, and facility registry. Next, Christina. So how we define the existing condition from national to subnational level? We start from our perspective of national strategy regulations. Every 5 years, we have the strategic planning Ministry of Health and already put into the law of health the regulations, and also converted or translated to the master plan in health sector. We call it like the master plan in health sector. This is the national level and aligned with the strategic planning of health program. And we want to see the enabler here. The technology and information system must be applied with the national strategy levels. We call it like enterprise architecture here. The blueprint currently has been working until 2024 this year, and also the initiative and move to next phase of the implementation. We call it like digital transformation for the 2025 until 2029. And based on this condition, based on the CHISU implementation, I think the most important to see the maturity. We want to see the measure how to achieve the blueprint into practice. Currently, our working is Sochi. We have and translated to the Indonesia or local context. We call it like digital maturity index here. And it's most important here how we achieve from the technical approach in subnational level. Every activities, every technical assistance, product implementation, digital tools implementations is from the low level area in our limited and fragmented limited setting. For example, governance, how to implement the governance of the health information system apply with decentralization context, how we apply the interoperability and availability in terms of to create a new application or digital and apply also with decentralization's innovation, decentralization of the ecosystem, and also the centralization of initiative, how to increase, how to improve to national health program. So the third is about data use itself. So in our domain here, we see the opportunity not only top levels, but also bottom up interventions. And we hope during the measure we can utilize here how the enterprise architecture, national strategy, for example, here to achieve what the health program needs, not only for the provider, but also the patient, and also the bodies or organization at facility level or subnational levels. Next. So currently we are working with a number of data sources, including facility levels, national and subnational levels. we see the collection of the and process and utilize of the data is very, very broader here. From the governance, security is very important, technology, application, data, and registration. It is the technical condition right now we can describe. And this must be aligned with the national strategic planning, like health information strategic planning, or also blueprint for the next implementation. And the PDP series also must be entity, national researcher, patient, ecosystem, or bodies in Indonesia. And it must be standardized as well. Christina? Okay, so how we approach to carry out the strategy architecture focus harmonizing across levels here. We have the national strategic and plan. We have to standardize for the measurements, technical approach, and everything to see the ecosystem developments must be aligned with the national and subnational levels. And also we have to make sure the subnational engagement is very important here because they are the entity or bodies to see the result of the population. Health outcomes must be deployed at subnational level and to see and apply with the regulatory environment here. So that's why we can improve availability and data, availability and quality of the data. We can increase the efficiency and effectiveness, and we improve health outcomes here. Back to you, Christina. Thank you.
Thank you so much, Tafiq. I really appreciated all of those slides, and especially the one where you were showing kind of how you were transforming and taking the architecture across to digital transformation strategy, but then even at the bottom where you talked about how you were taking that technical approach to and driving the demand for data, so across the levels of the health system. So yes, really appreciate your presentation. Now I'm going to turn it over to Jay, who is going to share with us some of the experiences that AHIN has had in advocating for enterprise architecture within the Asia region, as well as some of the work that they've been doing to strengthen capacity. So over to you, Jay.
Thank you, Christina. I think most of the members might already be aware about AHIN, but maybe I should also give a quick introduction and then get started. So AHIN is a digital health network, and it's a collaboration of various digital health advocates from South and Southeast Asia, committed to promote interoperability for better health. And then we were created in 2011, and at the time we had just had 6 members from 6 countries. Now we have over 2,400 members with presence in 82 countries, and then have secretariat in Manila, Bangkok, Jakarta, and Kuala Lumpur. And our vision is to have interoperable digital health systems for universal health coverage and health systems in Asia. And the mission is to promote learning, resource sharing, and knowledge exchange to strengthen digital health through networking approach. And the AHIN's strategic areas are to promote leadership and governance for digital health, facilitate capacity building for digital health, create opportunities for knowledge exchange and resource sharing, enable interoperability through standards. So these are the 4 critical strategic areas that we focus on. And then, as already mentioned by Christina in her opening remarks, like AHIN did the study in the region, thanks to the work together with, I would say that the School of Community Health at the University of New South Wales, Australia, and then the WHO Collaborating Center for eHealth. Together with them, we did the study on EA, and then like the studies were already, the results were already summarized by Christina. Countries are in different states of maturity. And then a few years back, that there were still countries who did not have a digital health strategy, but then now most of the countries in the region do have a strategy. But it's a different question whether the strategy has been costed, and then the cost and the strategy has been taken into implementation. So one of our core focus is capacity building, as I mentioned. Christina, we can go to the slide on AHIN Academy now. So we have been actually providing training right from our inception. Like we have the data here in the slide from 2013 that we started actually from HL7, and then like this particular slide has this data up to the training that we provided on digital health planning national systems course in 2022. So as you can see that we have provided training in both TOGAF as well as Archimate, because we felt at the point in time that there were many in our region they were working on the digital health strategy or the blueprint. So we felt like we should support having the pool of resource persons, preferably based within the ministries of health itself. And then we provided this training because that was an ask from those countries. And then we chose these two in terms of EA. One is TOGAF, which is the development framework for EA, and then also the modeling language, Archimate. Both we provided. But having said that, like from our experience, like unless otherwise, someone who has been trained has the mandate to work on this topic, they easily lose the touch. And then it's not that like somebody gets trained in this, certified, and then they can straight away start putting together the enterprise architecture. That's a different thing. But at least our aim was to actually create these resources and then make sure that they can actually work together with the other resources available in the country, and then help the MOH shape the National Digital Health Blueprint. So that was the aim with which we provided training in EA. The next slide, please. We also formed a community of practice because, as I said, most of the times MOH in countries, many countries do not have a very clear career pathway for digital health, or does not have roles and responsibilities with respect to digital health defined. Most of the times it is like it is shared, like someone who is already there in the department of HMIS or statistics or health information systems actually works on this kind of programs, national digital health programs, and that too mostly on a not full-time basis. So we also felt like, having a community of practice, especially, and then we have this for most of the trainings we provided, so that, this community can continue to stay in touch, learn and share from each other. So this is known as Enterprise Architecture Council for Health, EHIN REACH. And then our aim was to actually train and build the capacity, and then also pool the TOGAF certified architects, because most of them, like we found after training, if there is no opportunity in the ecosystem in the country, they actually move away. So it's not just providing the training or capacity building, but then like we also have to find ways and means of meaningfully engaging them to put the learning into practice. And then they should also find an opportunity for them to actually work on this. And then after training, unless otherwise, they also work and gain experience in this. Like it may not be of much use after the training. So we established this particular community of practice so that those who are trained by us from various countries can continue to keep in touch, engage them, and then we also invite them for further training, and then our events also. And then one of the aim was, many of the countries at the time were also embarking, as I said, in the development of the National Digital Health Strategy and the Blueprint. So for them to share experiences, what worked in the country, what did not work, because sometimes the success is shared, but what did not work mostly doesn't get mentioned. But as a peer network, and then it's easy to share informally, and then also support each other. And then in our region, one of the things that EHIN tried to build is, like, rather than being dependent entirely on those consultants who are often imported from other countries, we wanted to build a local ecosystem on that. So that was the aim with which we built this community of practice. And then I know for sure some of them are still working on this EA, and then some of them are actually also supporting the countries in the development of EA for them, and then also as consultants elsewhere. They are still engaged with the network. Next slide, please. And with respect to the focus as a network, so since we do many things, and then we have 4 strategic areas to work with, and we believe, like, after 12 years of working together with countries in the region, we fundamentally believe in these 4 critical areas, which we call health information building blocks. We aim to actually strengthen countries in that. So one is governance, second is architecture, program management, which includes people, and then standards and interoperability. We did a survey among the countries that participated in the AHIN GM that happened in Myanmar in 2017, and then more recently last year we had a second iteration that happened in Kuala Lumpur. We got together AHIN Working Council members from 13 countries to come together and then work on a regional call to action. And then they now have also a template and then also an advocacy paper with which they can approach their senior management in the countries, especially to work on and support these 4 areas. So architecture is one of the critical areas, as you can see. Next slide, please. So when we actually work together with our working council members, who are essentially the representatives, the country representatives or the digital health focal points in countries, they came up with this, like the consensus was, we should implement an integrated and standardized digital health blueprint that is aligned with national health and digital vision. Because most of the times, like we also feel that sometimes countries have telehealth strategy, national digital health strategy, or a health or HIS strategy. And then there is a lot of fragmentation that is happening. And then also there are countries now taking this GovTech approach where the support for digital transformation is being centralized. So people are actually being moved to a separate department, and every country has its own approach. But what we have been advocating is, like, as long as the national digital health strategy is actually based on a plan or a national health plan or a national health strategy, and then also costed, that will be helpful. And we have been actually supporting some of the countries in the region, especially through the convergence workshop, which I will cover in a few minutes. But in our region, like giving a status of our region, like the study, what we did in 2020, probably if we repeat it either maybe later in this year or maybe next year, I think we will have more interesting results coming in. Because many countries actually are on the verge of implementing the national digital health strategy. And then yes, the question, like I do see some question in the chat, like where do we also start? Like this is a question that keeps coming up from countries, and then countries really need guidance of where to get started. Where does enterprise architecture for health come in? And then because most of them have a strategy, but that is either in paper or PDF, very well done, but when it is taken to implementation, then are the challenges that come in, and then the resources are not aligned for implementation of the strategy. And then that's where AHIN gets a lot of support needs. So we have been actually working together with multiple development partners of supporting countries. So primarily we have 2 occasions, but then like I think we will Christina, let me move to the next slide. In our region, we have countries who already have a digital health strategy or an architecture, and then many of them are in the implementation phase, at various parts in the implementation phase, I would say. So that's the reason, like AHIN, during the general meeting that we had in Jakarta last year in November, we chose this particular theme of putting the blueprints to practice, because most of the times this is where the problem comes. We have the strategy or the blueprint, but then taking to action has been a problem for various reasons. And then that's where, like, we had this opening panel in this meeting where we got 2 countries from the Southeast Asian region, and then we also had 2 countries from the Western Pacific region. I'm talking about the regions, WHO regions here. And then we had a very interesting opening panel of how each countries are there, where they are. And then currently, I would say, I think 3 countries from the region of Southeast Asia are on the verge, are in the process of developing their enterprise architecture. Next slide, please. When countries approach us, there are typically, I would say, 2 categories broadly. One is, it's very rare in the recent times that countries still do not have a national digital health strategy and a costed plan. And then the second one is the country already has a digital health strategy, but they have issues with implementation. That's where, like, AHIN conducts these convergence workshops where we work together with the MOH under the MOH leadership of MOH, but bring together various other stakeholders in the country who are critical for the digital health transformation. And then also the donors, the development partners, the academy, and then the national professional societies, get them all together to either, like, for example, if the landscape assessment is already available in the country, that could be the starting point with the maturity assessment. If that is not, like, this is one of the things that is taken up as part of the convergence workshop. If the strategy is not yet in place, we help the country to have a digital health strategy and the vision in place. And then if the strategy is already in place, we identify those gaps and then get all the stakeholders aligned, and then also get the resources aligned for implementation. So that's what we do in the convergence workshops. And then convergence workshop, why I brought up the topic of convergence workshop is that's where we also advocate for enterprise architecture approach, and then to avoid the fragmentation that is there. But I think with that, I think I will stop here, and then we'll be happy to take the questions in the later part of the panel. Thank you.
Great. Thank you so much, Jay. And it definitely, lots of your presentation resonated with me, but especially the part where you were talking about the AHIN academies that you've had and being trained in some of these methods and frameworks, that just because you're trained doesn't mean you just can go out and develop an architecture. And I'm trained in TOGAF, and I felt very similarly when I had my training. Not only that, I wasn't even sure where to start once I had the training, but that I wanted a community of practice to kind of take these really abstract concepts and apply them into the health sector. And I think is an important, is a big need to tailor some of these to these frameworks and approaches to the health sector. So now we're going to start with the moderated panel discussion. So I would like to ask my panelists if you're able to turn on your cameras so we can move into the dialogue portion of our webinar. And thank you all to the audience. I see many of you are posting questions in the chat, and we will definitely get to those in a little bit. So keep putting in your questions. And I know that we've been busy trying to answer them, but we'll also to kind of read those out loud in a little bit. So my first question to the panelists, and Jay, you already touched on this a little bit in your presentation. So maybe Emmanuel, you could take this one, but is how are you strengthening the institutional capacity for managing and maintaining enterprise architecture, especially given the challenges that you've all highlighted in your presentations and that were highlighted in the study from 2020?
So one of the opportunities is like also participate like as a community of reach, as I mentioned. So that is an opportunity to engage with the community, because we have trained some of them in the region, and then some of them I know are actively engaged in supporting those respective countries. So one way of learning and sharing together is to engage with the community. If anyone is interested, like, I'll be happy to make the connects. And then with respect to how do we actually support the countries, like it depends exactly on the ask, because like the needs from the countries are not the same sometimes. And then also it also depends on the approach the country wants to take. And then, as I said, the training and certification alone doesn't solve the problem. Doesn't mean that, like, again, like just to reiterate what you said, like it doesn't make someone to straight away go and design the enterprise architecture for the countries. But then at least this community is there who is already aware of the concepts, who is already aware of what is happening elsewhere in the region, and then the experiences, and then they have already looked at some of the blueprints of their peer countries elsewhere. That's the value that they actually add when they work together with the other resources in the country or the consultants who have been actually recruited. Because I know for sure there are 3 countries in our region who are in the process of developing their architecture. At least those resources trained by AHIN, some of them are AHIN Working Council members from countries. They're actually involved in the process, so they get to understand things better, and then they also have the support of looking up to their peers elsewhere. and then they already also get to know sample blueprints from elsewhere, and that's the kind of support that we give. Also, this topic is difficult. Sometimes it's difficult to explain. So recently, AHIN had this convergence workshop in a country. It was very difficult to even translate the word enterprise architecture in that particular language, because it's easier to say it in English, but then to be translated in another language and then to be understood in the exact way is also difficult. So I would say that as a network, we also have this challenge, and then we are also trying to see if we can standardize this terminology in digital health, especially the word enterprise architecture. And means it's our support, like again, like, you know, it's not one way. There are multiple ways of doing it. So for example, one of the countries like which did enterprise architecture wanted support, especially in institutional, means to have the governance part of it operationalized. So they had a convergence workshop together with us. Like they asked for our support to have a convergence workshop that focus only on the governance part. So under governance, then again, they divided into IT governance, health data governance, and then also the cyber security, and then some of the priorities that they had. So it depends actually on the ask, and the typical ask, and the country situation. So so one way of saying is like, if anyone who's interested in getting in touch with this community reach, which I mentioned, I'll be happy to make the connects. And then also, like, we are still working with a couple of countries who are on the development path. So maybe I would be in a better position to answer a little later, maybe a few months down the line, that how we have been able to support. Thank you.
Thank you, Jay. And yes, your comment on translation also makes me think about how I felt with the TOGAF training, that there's a lot of abstract concepts in there that I think would really benefit from some translation into health. For example, when we talk about viewpoints within an architecture, what does a viewpoint mean in the health sector? So we could get very detailed into that, but I don't want to lose our audience here. Emmanuel, do you want to speak a little bit to the institutional capacity strengthening that you and the team have been working on in Ethiopia for enterprise architecture?
Yeah, thank you, Christina. As you know, institutional capacity building is not something that we do overnight. It is not a one-time endeavor. It is a continuous effort. It really demands engagement, focus, continuous communication, and making a strong business case. As I mentioned earlier, the mechanism we followed is making strong business case. Why digital health architecture for Ethiopia's health sector? So, and we had to like create clear understanding of like the marriage between this technology realm, the technology island, and the business island, which is the health system. So that is one thing. The other is those initiatives have been linked with government's initiatives. We are not technology sector, we are health sector. So alignment with government's needs. For example, okay, information revolution agenda is government's agenda. So how can we align those things, the enterprise architecture concept and information revolution agenda? And how can we unpack further so government can improve its health outcomes and, of course, the population's well-being? So those are some of the important things we did with government. And our endeavors, luckily, are governmentally. We do all partners support the government who leads those processes. We build the capacity of the government. Formerly, the approach was like prescribing what is important for government. That didn't work. Educate back, there was such a model, but it didn't work. Lots of investments have been there, but all of a sudden they have been trashed because they were not government internalized. So we are working with government to those things to be understood well and government to be on top of those initiatives. So we bring insights, we materialize those abstract concepts, how they align with the actual business implementation. So currently, luckily, one of the top 4 health sector transformation agendas for Ethiopia is that digital transformation. And we have like wide open space for us to bring ideas and to entertain. The last thing just to mention is genuine participatory approach for stakeholders. We have cleared out kind of like affiliation of those endeavors to single or a group of partners, JSI system, two-lane system. There has been such trend for long, but currently government is on top of it. So every partner has empathy and belongingness to those systems tools we establish, including the enterprise architecture. Those things have really brought a kind of synergy so that everyone would work for the common goal, and government capacity is strengthened that way. That doesn't mean we are in ideal situation. There are lots of struggles, lots of challenges in the process, but I would say we are in a good position regarding institutional capacity building. Over.
Thank you. I know it's going to be a long journey, just as the implementation of these architectures themselves, right? These are a long-term investments. So the next question that I have for you all, and I think Tawfiq, you specifically had an interest in speaking to this point, was how are you aligning your work in security and privacy of health information with the work and prioritization of enterprise architecture in Indonesia? As we know, security and privacy of health data is a large concern, and is something that needs to be taken very seriously, and is gaining more visibility as we see lots of cyber attacks around the world. So yeah, could you speak to a little bit about that work with alignment with enterprise architecture?
Yeah, thank you, Christina. So Indonesia, we have the we call it currently working with data privacy at the national level and subnational levels. To prioritize the security and privacy here, our health sector able to build resilience and comply the system for the strategic goals, for example, like the health component in to protect their service provider, patients, and data is very, very important. And currently, we are working to make the security and privacy are foundational to building trust with the provider, patients, governments, including the regulatory bodies here. So it's like the component from the strategic measure or tools is currently combining to see the opportunity how to implement the foundation levels here. And also the identification or mitigating risk is very, very clear to mention about from the beginnings must be is a good way to proceed, and must be proactive approach to reduce the security breaches and data leaks, especially for the health or community or populations data in Indonesia. I think the considerations of the security and privacy is currently very, very important to leading more resilience, especially for the abuse of the architecture, especially enterprise architecture for the healthcare. Christina, back to you.
Thank you so much, Tawfiq. So the next question that I have, I think this one is for Tawfiq and Emmanuel. Based on your experiences in Ethiopia and Indonesia, what would you recommend as first steps for countries who do not yet have an enterprise architecture but are eager to develop one? What would you recommend as a first step to starting the development of an enterprise architecture?
Yeah, I can start, Christina.
Sure.
And we start. This is the lesson learned what we had many years ago, and we also learned from the IHIN groups here. So first importance for us is to identify the key stakeholders. It's very important. The users is from the national, subnational facility, patient. This is our users, but we have to identify the key stakeholders. Representative governments agency is very important, such as Ministry of Health, ICT, National Security Agency, for example, for the security and privacy, IT department from their bodies, private sector partners, the organizations, academia, and civil society is very uh, concerned to identify the stakeholders. And also, after we identify, I think the most important what we learn also from previous year is to form the steering committee. We cannot only drive from the Ministry of Health. This must be combining from the key stakeholder itself is very important. And we learn something not only from national, but also the global. Training and education is very important to us, especially how to strengthen the from steering committee, for example, and key stakeholders must be know exactly what's the meaning of the enterprise sector, how the implementation, deployment, and also to control or measure the enterprise sector. Maybe this from my side. Emmanuel?
Yes, thank you. I think Tawfiq has already addressed a few of the things that I would use as an entry point for this. But just to emphasize on two of those points, I think the first thing should be really to come up with a well-documented, agreed upon, well internalized driver for digital health. I mean, for enterprise architecture. So that is, as I said earlier, that is the business case we bring to for decision makers to make their own decision. So that is what we did. The second thing is, going through, I mean, landscaping the potential partners and stakeholders and gatekeepers, of course, that have something to do with the enterprise architecture. So convincing the executive leadership. The other thing is engaging, truly, genuinely engaging all relevant stakeholders in the space is the first thing to do in enterprise architecture journey for me. Thank you.
Thank you, Tawfiq and Emmanuel. And I actually have a follow-up question to that. Have you been able to engage healthcare workers as part of your engagement? Tawfiq, I remember you just mentioned, building the trust as far as the security piece, but have you been able to engage healthcare workers in this transformation as well? And how, do you have any recommendations on that?
Yeah, as we developed the e-health architecture back in 2017, it was all about the health information specialists and digital health people. That was actually the wrong. That way the kind of highlight. Truly, there is a digital divide between these two groups. And of course, the business owners are the health workers. So it is the enterprise architecture that really has brought the engagement of the health workers, currently the clinical practitioners, child health, immunization, disease prevention and control, maternal health. We are now bringing everyone. We have focal personnel from every department because we are working on it based on the business needs. So currently, as we develop the enterprise architecture, the business is deriving the data, the application, and of course, the scalable infrastructure that is required for the future. So it is lately that we brought those places, and it was really vital. Over.
Yeah, I want to go extend about the development and implementation. In Indonesia, we conduct many things of the user experience survey and encourage them, especially not only from the end user, but also from the associations. the patients, a provider, and the group of the insurance. These are our key stakeholders. And we appoint some selection about how to encourage them, and especially to support the digital transformations for the from the scenes of the development until testing. So this is the process. For the enterprise architecture, currently we are working to see the opportunity to encourage the local or organizations and able to see the opportunity from the patient as well, not only from the rural area, but also the urban area as well. Is demographic is currently broader for the patients context, but also to see the availability of the another context of the enterprise architecture, such as how to develop the good application with the secure and private security for them, and also how to uh, make sure they are able to utilize and use for the applications as well. Christina, thank you.
Thank you, Tafiq. And then I have another question, and I don't, and anyone can speak to this, although I know Jay had an interest in speaking to this based on the AHIN's experiences. But what do you see as the biggest needs in terms of global or regional resources for countries to use in adopting enterprise architecture into the health sector? So I don't know, Jay, if you want to answer that, and then Tafiq or Emmanuel, if you have anything you want to chime in with.
Yeah, thanks, Christina. This has been an ask from countries because countries still have a problem in multiple ways. One is expertise, one is like where to get started with, depending on where they are, and then also the financial support. So one of the ask is like, is there any clear guidance in terms of where to get started with? And then also, if the country does not have a resource in terms of enterprise architects who could be engaged, a pool of the architects who have the experience in the region and then who could be engaged, that's another. And then the most important thing is like most of the times the countries have already figured out these two, but what they need is the financial support. So this is something that we are coming across when we actually work together with the countries, because this is a long-standing effort, and then it takes a long time, and then also takes a lot of investment. It's difficult for them because most of the times people are okay to make a capital investment and then once, but then some of the things are recurring, and then it takes quite a bit of time and effort. So this is a kind of guidance the countries like. It's more of some tangible support rather than tools and frameworks, I would say. The countries already know to an extent, like, yes, this approach is required. And then, but then what? Like, who will exactly support me? Whom I can engage? Who has this experience of doing it in countries, and then where it has worked? Can we actually show them the evidence of how it has worked? And then those examples also should be something relatable to their country context. It cannot always be like, I don't want to name the country, but it is a global example. But then not always that country's example can be transferable or relatable to my own country. So this is concern that many of them share. So they want to look at someone at the same level of, I would say, digital maturity, having done this, having things worked, and then also, are there funds? Are there any donors or partners who are willing to work with them and then have the enterprise architecture for health done for them? So that's what they look at it. Thank you.
Yeah, thank you so much. Yeah, and I think your experience in the Asia region really probably it mirrors other experiences in other parts of the world, and that need for a community of practice and a place for people to share their experiences, and like you said, meet folks kind of who are at their same level, and who maybe share some some similarities in context to help them contextualize some of these frameworks and tools. Emmanuel or Tafiq, do you have anything else you would want to add as far as what you think are needed in terms of global or regional resources?
Well, it has been pressed, um, bridging the clear island between this technology realm and the health sector is essential. Digital health is booming. The enterprise architecture is meant to link those pieces for countries. So definitely, whether we like it or not, digital health concepts are disrupting everywhere in health sector service delivery. So we have to pursue, we have to embrace those things. That is something I want to highlight. So we have to convince the governments, the people who are making decisions regarding that, the need, the demanding aspect of this enterprise architecture for countries and regions. It's not a fancy exercise. It is about bridging and linking those dots together for the better health outcome.
Yeah, thank you.
And I want to extend from Jay and Emmanuel as well about we have to see the clear of the contextual of the country. So we can, and also we can utilize the existing resource from the global and deploy maybe can be smoothly of the implementation or development because they already know about the context of the country and also about the context of the health, especially healthcare here. Thanks, Christina.
Thanks, Tafik. So now we're going to move into answering the questions that everyone has been putting into the Q&A box and into the chat. I know that we have, I think, answered many of them, but I think some of them, I'm going to try and have us kind of repeat some of them so that the broader audience can get the responses, and the panelists can even say a bit more. And I think actually the first one I would like to revisit, since Emmanuel, you just kind of mentioned that bridging of the gap between the business and the technology. We had a question that was, to what extent do the Indonesia and Ethiopia enterprise architecture scopes include a business architecture? Can you share your experiences in health systems restructuring and process reengineering if they were part of the architecture scopes? So Emmanuel or Tafik, would you like to respond to that one?
Yeah, I've already mentioned that Ethiopia's triggering needs for enterprise architecture has brought lots of workforce to the space. So the business, the data, the application, and the technology aspects are now linked very well. But before we come up with the concept of enterprise architecture, there has been a kind of disconnect still, as I presented earlier. So even though we work with the house workers, it was more of prescriptive approach initially. The enterprise architecture, its requirements, its artifacts, its diagrams, its descriptions, everything demands to genuinely document everything in the process, including the business requirement. So that's the business requirement drives everything else. So because of that, we are in good shape regarding bringing that marriage back. Over.
Yeah, and also to align with the business requirement, we have to see from the national or Indonesian context about the top-down approach here, especially how the business owners, like the stakeholders from the top, is currently working on digital transformation and also health program transformation. It's like the transition from the version of the healthcare as the business to be must be transformed in this context, and also the business process must be a good or genuine from the low level, facility level. Currently, we are working with the centralization process of administration. How we align with the decentralization and national context must be fit to deploy of the enterprise architecture and also fit to the end user. Christina.
Great. Thank you both. The next question we had was, Tanvir wanted to know which was a heavier lift, the policy development that supported enterprise architecture or the actual implementation. So if who wants to take that question on.
Yeah, I tried to text a bit. All the bets, definitely, we don't say policy is simple, implementation is difficult, or the other way, otherwise. So what we can say is when we go to policy, we have to first be able to, we have to be able to understand the landscape, what is actually happening in implementation. Policies are to tackle implementation challenge and to frame and for better outcomes. So in most cases, I would say lots of beautiful policies are there. Implementation has been a challenge, but we have to go back again and check if our policies were correct, or the enforcement or the endorsement or materialization mechanism has been there. For example, for enterprise architecture, there are 4 key steps. We have to measure the maturity. We have to develop the architecture based on what is available and based on triggering needs that we have identified during the maturity assessment. We have to also come up with the governance and change management mechanism to materialize those pieces, and then you have to go to implementation. So for implementation, you need resources, you need people, you need capacity building, but there shouldn't be any disconnect from the very beginning. We have to engage all relevant stakeholders, and we have to make sure that we have resources for the entire course. So the return on investment should be estimated technically and documented before we go for some initiative. So otherwise, we cannot judge that implementation is complicated, but policy is simple. We cannot say like that. Thank you.
Thank you. And we had another question earlier on that I think warrants a bit more discussion. Is there a recommended guideline for enterprise architecture blueprint development? Would anyone like to take that question?
I know there is an effort from World Bank, which they also were there with us at the ANGM last year in November, and then also had discussions like, I'm not sure, I think it's not yet in the published, but I think should be coming out soon. So that actually also guides countries in terms of developing enterprise architecture. So, but I can check again when they plan to actually publish it. But I know there is a work already being done by the World Bank.
Great, thanks, Jay. And yeah, I know we also pointed out that there are some frameworks that can be used, but I think the development of some specific guidance would be really helpful. So we'll look forward to seeing that when it comes out. The next question that actually I had when I was listening to the presentations was, Emmanuel, for the clearinghouse, I was wondering kind of what happens if a system is declined? How do you handle maybe systems that don't meet your standards? Is there like, are they given time to kind of adapt to those standards, or does the architecture also kind of make allowances for bringing in systems that maybe aren't built to certain standards? How does that work?
Yeah, thank you for this question, Christina. The digital health project inventory system, the triggering factor for that was, even though we had like syntactic and semantic standards for interoperability, for systems to be implemented, if they have like APIs and lots of things. So even though those things are just documented as a policy, and no one was referring to that document, and everyone so programs goes and implements a system that is very strange for us. So we came up, like in 2019, we came up with 77 unique applications on public sector that are implemented to track data for different systems. Yeah, 77 is not too much, but when we see the purpose they were deployed for, they are too much. We don't need those 77 applications. And so that inventory led us to come up with some mechanism that can be digitally triggered. I mean, the whole thing that we are planning is now the system is one thing, the government system. It registers, then there is a documentation criteria based on those standards we bought. There is a documentation mechanism, GitLab for source codes to be documented. After those things, registration certificate will be issued for the vendor. But that doesn't mean it will be implemented. There is a board that is going to approve if the system is not a duplicate, if it is relevant, if it captures somehow integrated, follows integrated approach, because we cannot afford thousands of systems to be implemented on the ground. So we follow the integration mechanism I presented earlier. So those things are the criteria for the board to approve that. So it is two-step approval mechanism. Once that step has been approved, then it will be implemented to the health system, and all partners are like allowed to inject their resources for that implementation. That is the mechanism. It is work in progress. It is not perfect, but we are in good shape regarding that standardization. Yeah.
That's great. Thank you for sharing that process with us. So I think maybe we have time for one more question before we wrap up. So Emmanuel, you alluded to this a little bit, so I'd also be curious to hear what Tawfiq and Jay have to say. But we had a question about from Leah about the challenge that it was to make the business case. So can you talk a little bit more about how you've made the business case to stakeholders? What would you see as the selling point for enterprise architecture to stakeholders, especially maybe your non-tech stakeholders?
Is it to me, Christina?
Okay. Sure, yes, Jay, go ahead.
Okay. I think one of the things is like example that we give is also the analogy of a house or a city planning that we often use it to explain what is enterprise architecture, because it's not very easily understood. That is an analogy that we give, how a well-planned city is functioning. I mean, some of the examples that we give also give the example of a house planning for them to understand, sometimes to oversimplify. Also, like fragmentation is a classic case. But then like how we actually move from there, like, and then some of the countries also have a federal structure. I think India and Indonesia is good examples right now in the panel here. And then where the state or provincial governments already have an enterprise architecture for their own e-governance system. And then of course, like the government, the central or the union government comes up with an overarching architecture that actually brings everything together. That's what India did. Like some of the states already had their own. And then there is an India enterprise architecture. And then they went for the federated approach. These take actually time. And then we try to give some examples and then explain. That's what we do. It's still a work in progress. It all depends on how we give different examples and then different situations and case studies to explain. And that happens over time. So it's no one single way of explaining. It depends on whom you are explaining to. Sometimes if it is a very, very senior stakeholder, or means leader, so they may not understand the technical details of it. So you may have to explain in a different way. But if you are talking to someone who has already a digital health department, and then they know about a bit about strategy, architecture, and everything, the explanation with them will again differ. So there's no one way to simply say. Maybe others, my colleagues here, may have a better way of doing it. Like that's what we have done. We usually give this example of city planning, and then we also give the house planning example. And then we also share the architecture that is already out in the public domain. But sometimes we have to explain them in a very simple way.
Okay. Thanks so much, Shay. Tawfiq or Emmanuel, do you have anything you want to add? I really like the city planning example, actually. I think that's one I'm going to keep in my back pocket.
Yeah, it's a good sample, especially for Indonesia, and a lot of must be documented very well here. because in many ways of the organization, such as the ministry, for example, they regularly make changing of the key persons or key people. So we learned also from many years ago how the enterprise access must be important, and we have to reintroduce again, maybe 2 years later or something. It's the regular condition, and we have to measure how the position of the enterprise sector implemented well or not. Christina, thank you.
Thank you. All right. Well, I think we are almost at time. So I want to thank our presenters and our panelists, Tawfiq, Emmanuel, and Jay. Thank you so much for all your hard work to prepare for this session and for this engaging discussion. And also a really big thank you to our audience who stuck with us for the last hour and a half. We wanted to expand this a little bit past an hour because we always have so much to say and so much to talk about. And thank you so much for all your questions and dialogue on this topic. So please do reach out to any of us if you want to continue the dialogue. We'll be sharing the slides and the recording after the session. So now I'm going to hand it back over to the Global Digital Health Network to close us out.
Thanks, Christina, and your team of very amazing presenters for those amazing presentations and the great insights that we've picked from you. It's really amazing to finally see these blueprints move from the papers into real implementation and application, but it's also very good to know and that the health workers are really engaged in this whole process. It really supports with the sustainability and ownership of these solutions. Thank you everyone who joined us today for your time for our June webinar. We do look forward to seeing you at our next webinar. And please do not forget to submit your abstracts. The deadline is July 10th. And we do look forward to seeing you in Nairobi in December from 4th to 6th. Thank you so much, everyone, and have a great day.
Thanks, everybody. Hope to see you in Nairobi.